All right, once again, this is Paul Miller, and welcome to tonight's Zoom meeting. And tonight's the focus is what? Well, the focus is going to be on alignment, and we're going to be talking about specifically the alignment AVA PPO plan and the letter that you received about 2 weeks ago, and the communication that has come from alignment, and a little bit of maybe, I would say, miscommunication, or maybe some things that have been misunderstood in the letter. So my job is, number one, to help you understand the changes that are happening. And these changes won't be happening until when? 2025. So there's absolutely no change to the current plan for the rest of this year. But if you think about it, when Scripps made their decision a year ago to terminate the relationship with all HMO plans, they didn't really announce that until it kind of got leaked out into the press, and it probably started happening right about the end of August and into September, right as we're about to get into our big annual election period where clients can make some choices. But it was like a bomb went off, right? So close to the end of the year, and then everybody was sort of scrambling. So when Alignment was notified by Scripps that a change was going to be happening, Alignment took on the choice to say, we're going to communicate with all of our PPO members now. We're not going to wait until October. We don't want it to be another bomb that goes off. We want to be able to say, okay, listen, here's what's happening. And so that you have an opportunity to talk with me, to talk with your doctors, understand the change, and then have a little bit of patience, because then most of the things that we'll be able to do will be in the annual election period, which is, from October 15th until December 7th. So without further ado, let's get into it. All right. So I'm going to go ahead and I'm going to share my screen right now, and share here. And okay, I like participation. You know me, right? I like participation. So if you can see my screen, give me a little thumbs up in the chat, or just say yes or something like that, so I know that you are, seeing my screen. So can everybody see my screen right now? All right, I like it. I can see it. Thank you so much. I appreciate that. Okay, so we are looking at the Alignment Health Plan letter. Obviously, some of you have told me that you actually haven't received the letter yet. That's because some people might have chosen to opt in for communication via email. And then, of course, what happens to many people who get emails? They might have gone to spam or junk. So this is the letter that went out. You can see that, obviously the date, the member name, and street is all missing there, because this is a template to show, agents like myself. But what I want to do is I want to break down a couple of the key phrases and words that are in this letter. All right. So number one, I'm going to highlight this a little bit. We are writing to inform you about an important change to your Medicare plan, the AVA PPO 007. So one of the first things I have heard from a lot of people is, I can't believe this is happening again, and I can't believe that I'm losing my plan. Okay. This doesn't say you're losing your plan. What it says is, we're writing you about an important change to your plan, specifically the AVA PPO 007, right? So effective January 1st, 2025. So nothing changes for the rest of this year. Scripps Health, right? Scripps Health, not Alignment, okay? Scripps Health is going to be terminating its Medicare Advantage PPO agreement with Alignment Health Plan. Now, if I had written this letter personally, I probably would have written a little bit differently. But the way that they wrote it, probably has to comply with the Medicare guidelines and the attorneys and things like that, right? So the way I want to describe it may not be the way the attorneys wanted the letter to go out. But let me help you understand what it meant. All right. Last year, to put this in perspective, Scripps Health terminated 32,000 people. Some of you might have been in one of those plans last year, right? 32,000 people had their HMO plan terminated with Scripps. It wasn't the decision of SCAN or Blue Shield or Alignment or anybody else, United Healthcare, last year. It was a Scripps Health decision to terminate the HMO plans. So then heading into this year, 2024, there was a few new PPO plans that had come out, but Alignment had had a PPO plan for the previous 2 years. So, or maybe 3 years, because this is the 4th year of the Alignment PPO plan in San Diego. So there was a special grandfathering or a special situation that allowed Alignment and Alignment only to keep all of its members in the network with Scripps. So we're going to talk about what it means to be in network and what it means to be out of network in a PPO plan. Many of you probably already know this information, but we're going to make sure that we go over it so it's really, really clear. Okay, so the situation you're in right now is that you are in network with Scripps Health if you had had the PPO plan prior to 2024. So all of those people were grandfathered in to be in network. If you joined and your alignment plan didn't start until January 1st this year, then you're already what we call out of network, which means you still have access to Scripps, but you might have a higher, or you will have a higher copay when you access your doctors and specialists. Okay, so that's kind of the state of where we're at today. So what does this letter really mean? What did Scripps Health terminate in the agreement? They terminated the grandfathered clause, or the grandfathered people like yourself who can see the Scripps Health doctors in network. So they are not stating that your plan has been terminated. They are not stating that you cannot attend a doctor or see Scripps or go to the hospital. What they are stating is that you will no longer be in network. You will be considered out of network. Okay, so as you continue to read, it says, as a result, the following medical groups and facilities will no longer be part of the Alignment Health Plan PPO network. So again, kind of just restating what I just said, but what they were saying is there is, and we'll talk about it, but typically there's, like, I like to call it, 2 columns in a PPO plan. One of the columns is what we would say is all of the doctors that are in network. And then the second column would be all of the, well, the potential for you to have costs to go out of network. Because those people like yourself who were grandfathered in, you were in the network. And so the change is really that very last sentence, that they will no longer be part of the health plan PPO network. That means the in network, right? So it doesn't mean that you don't still have access to Scripps. So, okay, and take a breath. All right. Somebody's asking, is this the same information that I did cover last week? And the answer is yes. I sent out that email and I said, hey, this is going to be an encore performance because many of you weren't able to make it last week. And my recording didn't work so well. And so we're doing it again. So if you saw this webinar last week, then guess what? You have my permission to leave. You don't have to be here tonight. All right. So again, what are the parts of Scripps that are being affected? Well, Scripps Clinic, medical group, Scripps Coastal Medical Center or medical group, Scripps Cardiovascular Thoracic Surgery Center, and the Scripps Hospital Medical Services. Technically, that actually doesn't mean the Scripps Hospital. There were certain things inside of the Scripps program, such as, like, say, the mammogram or the radiology facilities were in network for you this year, but they're not going to be in network next year. So what they're really saying is the 2 main groups at Scripps, Scripps Clinic and Scripps Coastal. Now you might say, well, how do I know which doctor, I see right now? Well, here's the thing. I like to kind of look at it from a geographical standpoint. I think about Scripps Coastal being from Oceanside along the 78 all the way over to about San Marcos, because there's facilities in Oceanside, 2 main facilities of Scripps Coastal. There's one in Cedar in Vista, and then there's also one on the campus of Cal State San Marcos. So all of those. Then we can kind of start going south a little bit, and you'll hit the Carlsbad location, and then you'll also look at the one in Encinitas. Those are all Scripps Coastal Medical Centers. So if you see a little Scripps logo on the building and you're in those areas, you're probably part of Scripps Coastal. Then Encinitas kind of has a little bit of split. You'll start to see some Scripps doctors that are part of Scripps Clinic, But as you start heading south down the 5, you're going to see some of the other facilities like at La Jolla and other areas, and those areas are going to be typically Scripps Clinic. Now, again, that's not, specific to the entire area of San Diego County, but I like to think about it that way. It makes it a little bit easier to know, am I part of Scripps Coastal or Scripps Clinic? And listen, if you were inside of the Alignment PPO plan, you had access to both, and you could go in and out to Scripps Coastal or Scripps Clinic. So those are the doctors that we're talking about. Now, the actual hospital, meaning all of the Scripps hospitals, are still going to be in network in 2025. If you saw me at one of my presentations last year during, the AEP period, I talked about how there's 2 different types of contracts. There's a facilities contract, which is more talking about the hospitals and the ambulatory surgical centers. And then there's a doctor contract, right? Or a physician contract. And so there's 2 types of contracts. So for the majority of the facilities contract, you'll see that the hospitals and the ambulatory surgical centers will still be in network for next year. And that's a really, really good thing, because that means if you had a hospitalization, your costs would be lower. But the biggest part of the sad news is that the doctors themselves, the specialists themselves, you'll have access to, but you'll access them at an out-of-network cost, so slightly higher. Okay, so that hopefully can kind of clear up a little bit of some of the confusion that has happened about this letter. Many people read it quickly, looked at it and said, oh my gosh, I'm losing my plan, or I'm losing access to Scripps. And the truth is, you are not. They're just making a change to the plan. And once again, it wasn't Alignment's decision. It was Scripps's decision. And for me to address, why that happened, it would just be me kind of guessing. So I'm not going to really address that for you right now. All right, why did they do it so early? Well, like I said, they wanted us to be able to have ample time to explore your options. There's a couple of, very kind of minimal or rare situations where you might be currently receiving treatment from Scripps and eligible to request a continuation of care, but again, just under very certain circumstances. All right, what are my options? What are your options? Well, we might have a special enrollment period. So there are certain situations, and we're not going to get into all of them, but if someone had a Medicare supplement prior to enrolling in Alignment plan, and you tried Alignment for this first year, there could be a special enrollment for you to go back to a Medicare supplement. So who is Scripps taking? Well, without a question, they are absolutely saying you can return to original Medicare and keep your Scripps Health primary care doctors and specialists. So if you remember from probably one of the first times that maybe we met, we did a little Medicare workshop and we talked about how does this whole Medicare thing work, right? So if we start with original Medicare, we're just talking about your Part A and your Part B, right? So Part A stands for hospital and Part B stands for all the outpatient services. So the good news with original Medicare is it covers 80% of your costs. But that means that what? You're responsible for 20% of your costs. So you had 2 choices. You could either choose to stay on original Medicare and possibly get something like a Medicare supplement plan. And a Medicare supplement plan typically will cover 20% of your costs. So if you have 80% covered by Medicare, you get 20% covered by a Medicare supplement plan, you now have 100% coverage, right? So that is an option. The challenge with a Medicare supplement plan is just that it's one of the more costly ways to, protect yourself and round out your coverage. I know that most of you on this call are not 65, or you might be 65 heading into age 66. So if I gave you an average range, I would tell you that a Medicare supplement plan would cost about $150 to about $175 a month, and it could be higher based upon your age. So let me ask you a question. Is that on top of the original Medicare cost that you pay for Part B? Yep, it is. So if we know that Medicare costs on the base premium is $174.70 a month, so we'll call it $175. So if I have to have Medicare at $175, that covers my 80%. Then I get a Medicare supplement plan to cover my 20%, and that's going to cost, again, about another $175 per month. So now your total out-of-pocket cost on a monthly basis is about $350. And original Medicare doesn't cover drugs. So we have to get a standalone Part D drug plan. And this year we've had some great plans as low as 40 cents, $16, and let's say the average is $25. So again, if we round out the total picture of what this could cost you, Medicare 175, a Medicare supplement at 175, and a drug plan at $25 a month. So that means you're looking at what? About $375 a month. But you have 100% coverage and protection. And so you already had to pay the $174.70 to Medicare. So really it's about a $200 a month increase if you add the supplement and the drug coverage to it. But like I said, that's really your maximum out of pocket. Because if you have 100% coverage, it's just what you pay for on a monthly basis. So why did I go through all that? Well, because that guarantees you to see any doctor anywhere in America that takes Medicare, original Medicare. So we call that Medicare assigned or contracted with Medicare. So the majority of the doctors at Scripps Clinic, Scripps Coastal, are contracted with Medicare. So that means you have the opportunity to see them. The Medicare supplement just covers the 20%. So you could see doctors in Texas, you could see doctors at the Mayo Clinic, you could see doctors at the Cleveland Clinic, you could go up to Beverly Hills, Cedars-Sinai, right? You could go to any doctor that takes Medicare as long as you have original Medicare and the supplement plan covers your 20%. So that is the number one way that you are guaranteed to keep all of your doctors at Scripps. But why doesn't everybody jump on? Well, one of the first reasons might be is that it can be costly, right? If you're on the Alignment PPO, which I know you are because you're here tonight, you're paying $0 a month on top of the $174.70. So that would be a $200 a month increase for you, right? So number one, it could be costly. And number two is that there are Medicare rules that say you have to answer the medical questions if you're going to choose a Medicare supplement. Now, again, there might be some guaranteed issue situations, but we don't know what those are as of yet. Every year we know there's been about 2 to maybe 3 companies that allow you to switch from a Medicare Advantage plan to a Medicare supplement plan with no medical questions and no underwriting, okay? But there are simple things that, people who have diabetes, maybe you've had a heart procedure, things like that. Maybe you've had internal cancer. Those type of situations are basically instant denials, right? You can always go to original Medicare, but the Medicare supplement that covers that 20% has the ability, has the right to ask you medical questions. So we don't know whether there will be guaranteed issue scenarios until October, okay? And you're going to hear me say this a couple of times. Please be patient. Please be patient with me. Please be patient with the system and the changes. Don't get anxious about it. Try to keep your anxiety low because there's nothing that we can do between now and at least until October. And when October happens, then we're going to know what the plan benefits are, not just for Alignment for next year, but we'll know what all of the other insurance companies are doing as well. And we're hoping, just like they've had in several years, Blue Shield has had this underwriting holiday, which means that they've taken any person who's on Medicare and allows them to guaranteed issue get into their Medicare supplement plan. We've also saw that United Healthcare and Anthem did it last year specifically because of the Scripps situation. We're not sure if this is going to qualify for a guaranteed issue for all of the insurance companies, but we will find out and we'll know by October. All right. The other thing that I'll tell people is there's also another California rule that allows you to get a guaranteed situation to a Medicare supplement plan if any one of the benefits or the copays on the summary of benefits increases by 15%. If there's a benefit, a medication cost that increases by 15% or more, then that qualifies you for a guaranteed issue to go to a Medicare supplement plan. Oh my gosh, my PC is not plugged in. How about that? So I better plug that in before we lose this whole thing, right? All right, but let me finish my thought. So what does that mean to you? Well, again, let's say that you had a copay that says if you went to a specialist at Scripps, currently in network, it's $20, right? Well, what would be 15% of that? Well, 10% would be $2, so half would be $3. Okay, so if that specialist visit went from $20 to $25, that would give you greater than a 15% increase and would give you a guaranteed issue situation to allow you to go to a Medicare supplement plan with no medical questions. Okay, so that's one example. So we've got a lot of possibilities, but we got to wait until at least October 1st when the plan benefits get released to not just the agents, but to the general public. All right, and then we can make changes during the beginning of the AEP period, again, annual election period. We call it AEP, October 15th to December 7th. So now you have the opportunity to make a change if you need to, that then will go into effect on January 1st. Okay, so we're talking about some special enrollment periods, possibly some guaranteed issue situations that we can look at. And then we'll also talk about, well, what does it mean? What if I stay with the plan? Okay, well, we'll talk about that. Also, what if you wanted to go and find a new set of providers? Well, obviously, you could choose to see doctors that are outside of Scripps, right? The Alignment PPO plan has over 1,500 different doctors, specialists, primary care doctors that are outside of Scripps. And some of them you might even know by name because you go to them right now. So Alignment PPO was not just a Scripps-based plan. It was Scripps focused, but it had access to several other provider groups as well. One of the biggest ones I would mention to you would be Core Orthopedics in the Encinitas area, the North Coast Orthopedics, and how about the dermatology? How about dermatology medical group, or DMG, and dermatology specialists? All of those 4 groups that I just mentioned are very, very popular in North County. And all of them are what? Not part of Scripps. And so you would have access to them. All right, so give me a sec. I'm so sorry. We'll talk about what I should do next, but what I need to do next is make sure my laptop is plugged back in. So give me 2 seconds and I'll be right back. All right, I'm plugging in right now. So this is where what we say human error comes into play, right? All right, so you can look at other plans, and we're going to talk about that here in a little bit as well, because here's the thing. Once October 1st hits, we're going to be able to see what all of the other plans are doing. So we'll see what alignment benefits are, and we'll also see what all of the other PPO plans are doing as well. Listen, what has happened, one more time, is that we at Alignment are going to be just like every other PPO plan in San Diego with Scripps, meaning that Aetna, United Healthcare, Blue Shield, and Humana all have PPO plans in San Diego County right now. And every single one of them is right now out of network with Scripps. So now Alignment's going to have to join that group. So in 2025, every single PPO plan will be out of network with Scripps. So now we're just one of them, right? So what does that mean? Well, once October 1st hits, I personally will be going through all of the plans and I'm going to compare them, right? I'm going to compare the copays. What are the copays with Alignment versus Aetna versus United Healthcare versus Blue Shield, and see what that's going to be. What is the hospital copays, right? And what is the maximum out of pocket? So we're going to look at the alignment highlight sheet, and I've highlighted some key areas so we can look at that together. And then I'll show you what one of the other insurance companies' PPO plan looks like right now as well. So you can see the differences. Does that mean that you have to leave alignment? Maybe, maybe not. So we won't know until October. All right. So what do they say? Well, contact your broker and contact Scripps Health. All right. Now there's one more thing that I want to tell you about. So we're going to go ahead and we're going to skip. We're going to shift. We're going to shift. That's what I'm trying to say. We're going to shift over to the summary of benefits. But I'm going to bring something up. So let me focus again, just to let everybody know, we're talking about what? 2024, right? So this is this year's benefits. A couple things that people don't always remember about the current PPO plan is that it's not just San Diego based, okay? So any place that is currently contracted with alignment on the PPO plan, you have access to. Now, I don't know many of you who want to go to Fresno to see a specialist, but it's available, right? But you could go up to Los Angeles, and who's in Los Angeles? Well, guess what? Cedars-Sinai. They're in network with the PPO, as well as in Madera County, Orange County, San Diego, and Ventura. We obviously know about San Diego, right? But in Orange County, we also have UCI, okay? So UCI's network is in there as well. So you have, again, many, many more access to doctors, not just in San Diego, who are in network. Okay, so this year, the monthly premium is $0. And let's talk about the first big one, right? The first big one is the fact that we're saying, what does it mean, I should say, to have a maximum out of pocket? So a maximum out of pocket, I'm going to try my little spotlighter here, see if this works. So maximum out of pocket is $3,900 if you see only doctors that are in network. So this year, that's great. If only you do is see doctors at Scripps or other doctors who are in the network, your worst case scenario, that's what a maximum out of pocket is. It's a worst case scenario, no more than $3,900. But if you go in see doctors in network and doctors out of network, and it calls it combined, then your risk is what? $8,950. This is not a deductible. There is not a deductible on this plan. It is your worst case scenario. How does a worst case scenario ever happen? Typically, it's the big C word, right? Dealing with cancer and chemotherapy or radiation therapy, because those types of procedures are very, very expensive. And so in almost every single Medicare Advantage plan out there, your responsibility is the 20%. And so if you had $100,000 worth of procedures, well, that could be 20,000, but you have a max out of pocket. So next year it's going to be if you're out of network, it would be $8,950. If nothing changes in the benefits, you could say, well, it could be $8,950. But does it mean that's going to cost you that? Not necessarily. You're going to have a pretty major medical condition or catastrophic event that could get you there. But is it possible? It is. By the way, this plan this year is very similar to all of the other plans, and it has one of the lowest max out of pockets out of network versus the other competitors we've talked about. And I say competitors to alignment, right? But as a broker, I represent all of those other companies that I've already mentioned tonight. All right, so what about a PCP, primary care physician? Well, in network, it's $0 this year. Well, guess what? Check it out. What if you go to an out-of-network doctor? Well, guess what? It's still $0. So you can still see out-of-network doctors this year and still have a $0 copay, which is great. Now, here is a little caveat, and this applies this year, and it's definitely going to apply next year with Scripps. Just because you have a PPO plan, that doesn't mean that your doctor is going to accept it, okay? So many of us think that, hey, I've got a PPO plan. I can do whatever I want. I can see whoever I want, and I don't need a referral. Well, sort of, because if the doctor is not in network, they have the choice to choose whether they want to process the billing and bill to alignment for the balance. So if I saw an out-of-network doctor and it was $0 cost to you, that sounds great. But that doctor could say, yeah, we don't want to deal with the administration. We don't want to deal with the billing. Okay, so here's the only thing that I think you need to do or can do over the next, say, 4 months as you're considering these things, is if you're seeing your doctor, seeing doctors at Scripps, you might want to ask them, hey doc, I know that there's going to be some changes to my current plan, the alignment PPO plan I have. Next year, I've been told you're going to be out of network. Will you still see me and bill alignment as an out of network, fee? And see what they say. My understanding at this point is that Scripps is willing to do that and that the Scripps doctors are willing to do it, but they're not making a blanket decision across the entire network of Scripps. They're leaving it up to the doctors on whether or not they want to do that. So it would be very wise for you to ask the question, hey doc, again, I have a PPO that's going to be out of network. Are you willing to bill that next year? And if they say yes, awesome. That's good news. That means you could still stay in the PPO plan and have access to the doctors, but potentially at a higher cost. So where does that come in? Well, let's take a look at the next category, which is the specialist. So this year, if you saw an in-network specialist at Scripps, it would be $20 copay. If you saw an out-of-network specialist, it would be $50. So that means that there's a slightly higher cost when you would see a specialist that is out of network. So let's just imagine for a second that these copays are exactly what they're going to be in 2025. Now, remember what I said, I have no idea what the copays are going to be in 2025. But let's just imagine this was 2025 benefits. If you saw a Scripps doctor, you would be paying $50, right? So if you saw a Scripps specialist, you would be paying $50. And you would obviously have to ask that Scripps specialist, are you willing to bill Medicare, or I'm sorry, not Medicare, are you willing to process the billing to alignment to also get their additional compensation? Because let's think about it. A specialist is probably making anywhere between $250 to $500 for their services, right? So if you're paying a $50 copay, is that all they're making? No. It's not all they're making. So they would actually bill alignment for your visit and they would get additional compensation. Okay. That's what I mean by the administration side of it, that some doctors may just choose not to do that. But let me say it one more time. This year, Scripps is processing Aetna, United Healthcare, and Blue Shield and Alignment as out of network. So they are doing that procedure today. Will they continue next year? Where all indications are, the answer is going to be yes. So when I've talked to some of you on the phone or emailed and I said, listen, you still could have access to Scripps, but it might be at a slightly higher cost. This is what I'm talking about. So I've only highlighted on this, sheet here on the summary of benefits or highlight sheet, the out-of-network costs. So let's look at hospitalization. And believe me, I'm not going to go through every single one of these tonight, but I want to hit a couple of the key areas. I think seeing our doctors, our primary care, seeing your specialist, and also let's talk about hospitalization. It's not something we want to happen, but if it does happen, well, how do we deal with that, right? So right now, in-network, if you went to a hospital at Scripps, it would be in-network, and it's $150 a day for days 1, 2, and 3. And then days 4 through 90 are $0. And days 91 to 999 day, right? If it was one admission and you stayed in the hospital for 999 days, you would only pay for the first 3 days, which is $150 a day for 3 days. So $450. Guess what? With this plan, whether you're in network or out of network, guess what? The Scripps hospitals are in network. So that's a huge win because guess what? Aetna's not in network, Humana's not in network. And so with some of those other plans, you have a much higher risk. And then your copays would be something similar to this, right? 20 or 30% cost to have a hospitalization out of network. So Alignment has signed a multi-year contract with the hospital So in an emergency, you could go to Scripps and pay no more than $450 for a continuous hospital stay of 3 days or more. Okay, so I think that's great news. We have mental health, skilled nursing. Let's talk about skilled nursing. Well, Scripps doesn't have a skilled nursing facility. So it's whoever Alignment has chosen to contract with in the North County. So there's several different skilled nursing facilities. But as you can see, just pretty much like most of them, it's a $0 copay for the first 20 days. Okay, that's great. I've got fallen and broken my hip. I've had hip surgery, hip replacement. I'm not able to make it home and cook my meals and do everything I need to do ready. So I go to a skilled nursing facility, and those first 20 days are $0. And then after that, it's $100 a day. So again, you're in control in a PPO plan. You get to choose where you want to go. So if that was your situation, you can always pick up the phone and call me, and we're going to make sure that we get you to an in-network facility. Okay, but if you chose to go to an out-of-network facility, again, you can see a higher cost. Now we're going to see a lot more of the 30% across the board. Again, this is this year's benefits. So this is what we have. You have the choice, okay? And then the last really key area I want to touch on is ambulatory surgical center. We call that an outpatient surgery. Typically, whether that's a shoulder surgery, a knee surgery, cataract surgery, hand surgery. Well, think about even, gosh, I heard a most recent, one of my clients had gone in 2 or 3 years ago for a total knee replacement and stayed in the hospital for 2 days. He had the other knee done this year, and he was outpatient, right? It's crazy. Technology is getting better and better, and things are happening like that. Well, listen, if you go to an in-network ambulatory outpatient center, it's only going to cost you $100. And this year, all 4 ambulatory centers of Scripps are in network. So we don't see that changing for next year either. Okay. So emergency is the same, whether you're in network or out of network. You can kind of continue down and see how this works. One of the other great benefits I loved about this plan was physical therapy, right? In network, a $0 copay. Almost every other plan you're going to look at has a $35 to $40 copay per visit. So if I had, like many of you know, my Achilles surgery, and if I had that, a few years ago, if I had to go to a physical therapist for twice a week for 6 weeks, okay, well, that's what, 12 visits times $40. That cost me an extra $480. But on this plan, it would be $0. So will the Scripps facility next year be a network? No, it won't be. But there are several different several different physical therapy facilities that are in network this year. So just make sure that you choose an in-network facility if you can, right? There's great physical therapists out there. They don't have to be a Scripps facility. All right. So as you can see, continues on down, out-of-pocket, out-of-network costs are definitely a little bit more expensive, but all of the other benefits like the vision and the dental, enhanced dental, the OTC, right? Different things that are there. And even like say the mail orders or talk about drugs. Someone asked me, well, what about the drugs? Are they going to all of a sudden be out of network? No, because the drugs don't have really anything to do with Scripps. So you still want to go to a preferred pharmacy, but with Alignment, pretty much everybody's preferred. So whether it's CVS or Walgreens or Rite Aid or Costco or Sam's Club, you're going to get the best pricing. So this isn't going to affect your drugs at all. So here's what I want everybody to do for a sec. Think about the last 6 months or maybe the last year of your life, medically speaking. What have you done? How many times have you seen a primary care doctor? How many times have you seen a specialist? Were you hospitalized? Did you go to a skilled nursing facility? And think about those costs, because the great thing about having a plan like Alignment is paying $0 a month, seeing a primary care doctor once or twice a year for $0, and seeing your specialist for, $20. You might have an entire year where your cost was what, $40, $60 for the whole year? Or maybe now, with them being out of network, okay, well, that means the specialist cost goes a little bit up. But how many specialists are you seeing? So this is something to consider. And like I said, there's nothing that we can do right now. I'm giving you the information because I want to put you a little bit at ease. I want you to understand, like I said in that one email, it's not as bad as everyone thinks, right? Is it a little bit worse? Sure it is, because we have slightly higher copays when we're going to see Scripps doctors or Scripps specialists. But there's lots of doctors in San Diego, and there's lots that are in the network that you could continue to see. But if you choose to see a Scripps physician, great, you're just going to have to pay a little bit more for that. And one of the other areas you need to be concerned with is what that out of network, right, maximum out of pocket could be. So in a worst case scenario, means that you could be up to the $8,950 this year. Can your budget handle that? Okay. Now, there are some other products, and I actually work with, again, a lot of different plans. I'm licensed in 36 states, and I have an association plan that works similar to like an AFLAC. You might have heard of like critical care plans, hospital plans, cancer plans, cardiac plans. Well, there is a plan that I've been able to get that actually has a cancer plan and a hospitalization plan, where from anywhere between maybe 15 to 30 bucks, you could cover your hospital stay. So they would reimburse you. They would give you a flat amount for, say, cancer. So if you were diagnosed with cancer and you wanted to go to Scripps MD Anderson, well, guess what? Maybe it wouldn't cover all of it, but you could just get a check for $5,000. And that would actually help you protect your overall spending, right? Nothing to talk about today, but again, it's something that is unique kind of to me and my relationships to have this plan that works in California. So we can talk about much more of that later. So we're kind of here at the end of my presentation, and I'm going to open it up to, some of the questions that I see that have been typing in there. So if I haven't answered maybe one of your specific questions, please go into the chat right now. It's on a different screen. That's why I keep looking over there. But go into the chat right now and type up your questions, and then let's go ahead and answer them. And then I have no problem with go ahead and unmuting you. So there's a button that you can do that you can click that will allow you to tell me that you are requesting to be unmuted, and we can ask your question live, okay? So hopefully we covered a lot of good information here. I'm gonna go ahead and stop the share so you can see me live and in big, what's that called? Technicolor or something? Remember that? All right. So let's go ahead and see some of the questions that are in here. So could I send you information later on about a list of dermatologists that I mentioned? So I'm looking for one in North San Diego County. So absolutely, I can do that. And maybe this is a really good thing to do really quick. I didn't have the time to do this on the last meeting. So I'm going to actually do this really quick. So let me go ahead and I'm going to share my screen because I think this is really good for most of you to see. Well, not most of you, it's good for all of you to see. All right, so we're going to share the screen again. I went to this website that you hopefully have heard of before, which is called alignmenthealthplan.com. So just squeeze all the words together, right? alignmenthealthplan.com. So lots of information on here, but the thing that I use this mostly for is finding doctors. So you highlight over Find Care, go down to the provider search and click on Doctor. So it's going to pull up the next screen, and you'll see that we can look at doctors, facilities, dental, vision, and other. But primarily, we're going to look at doctors. So let's say we're going to say, I want all doctors, primary care doctor, or let's just talk about dermatologists. So we're going to do dermatology. This year, we'll only have an option to say 2024. Location, we'll just go ahead and pick on Carlsbad. Now, plan option. I always want you to do this. Select the plan that you're on. So scroll down, you see all of them say Alignment Health, and I've told you it's the 007. But look at this. It's not this 007, right? This is an HMO plan. So you want to keep on going down until you see the Alignment Health AVA PPO 007, right? The James Bond of PPO plans in San Diego. We can go ahead and we can leave the member group optional because a PPO plan is going to have many different medical groups that you have access to go to. Like I said, not just Scripps, okay? Now, if you wanted to look for a specific provider, right, we could type that doctor in right now. We're going to go ahead and click Search Provider, and that's going to give us all the dermatologists. So it's pretty quick. It's going to load there. Now I can scroll down and see dermatology, and everybody I'm looking at is a dermatologist. I can then take this radius and change it to a 5-mile radius of Carlsbad, which will pretty still give you a pretty good area. And now you can kind of see what's out here. Now, you don't have to open every single one of them. One of the things I like to do is I can kind of click on locations, and it kind of tells me where that one is. So that's a telemedicine. I can go down here. Let's see this one. Okay, DMG group. So for Jeff, who asked that question, guess what? DMG group is one of the ones I mentioned, and Vista Way. So just right up from, what is it, Rancho del Oro, a little bit around from the AAA office right there on Vista Way, there's a whole medical complex. And it's funny, there's dermatology or DMG on one side of the parking lot, and there's Dermatology Specialist Inc. on the other side. But pretty much a lot of people at DMG are very, very popular. Then here's a little secret. You can see from wherever it's choosing to look from in Carlsbad, it's 2.01 miles away, right? So now look at 2.01, every other 2.01 miles. These are all doctors at the same office, right? 2.01, 2.01, 2.01. So that means that this office has a lot of dermatologists at it, right? So anywhere between 8 to 10. A couple of key people, I'm sure you can probably, people will agree. Susan Shimame, she is very, very popular. A lot of people like her, Scheinberg as well. So that's a way that you can utilize the website. If you want to be looking for a primary care doctor, right? You can do that as well by just changing the search. Sometimes you do need to kind of switch. Well, you can see these are refreshing, so that's good. But again, we can look for all doctors, 2024 Carlsbad. Let's go back and just add the PPO plan real quick. So how many doctors are in the PPO plan that you have access to? And let's see what happens. All right. Well, within 30 miles. Now realize on the north side of Carlsbad, that means you're heading up towards, UCI, right? But, let me try something else. Anyway, you get the kind of the idea, right? So let's just go and let's say we're within 10-mile radius. So within a 10-mile radius of Carlsbad, 861, right? And then you can continue on down. These are all the doctors that are what? In network. So you do have a lot of opportunities to be finding doctors that are in network. And of course, I can help you with this, but I love just using the website because it's the most accurate usually. But I can go ahead and email you some information. All right, we got a question from Dan here. It says if a doctor is out of network, okay, the doctor is out of network, the PPO card indicates the copay is still 0. Okay, that's just for primary care doctor, but that is true. And then you said, however, North Coast Family Medical Group and Dermatology Medical Group are both charging $40. All right, well, Dan, I think you and I have talked about this, but you're going there, so I'll go there. North County Family Medical, I think you mean North Coast Family Medical, is no longer going to be in network with AVA PPO, and they are not even accepting the PPO plan moving forward. So they are not at all going to be in the network. They want to charge you like $500 to come and see them. Okay. So do not, unless you want to pay cash, go to the North Coast Family Medical Group. As far as the DMG, Dermatology Medical Group that we just talked about, they should be charging $20 in 2024 because as we just looked at, they are in network. And if they're charging more, then that is an error and you can contact me and we can get that fixed, okay? But again, like you said, they are not, as far as North Coast goes, they are not accepting anybody in 2024 nor 2025, and they are not a Scripps facility. They are just a doctor medical group of 4 or 5 doctors who have chosen to not be a part of the plan. So they will not bill as a result of it, okay? All right, Fawn, you got a question here. You said you joined the first part of 2024. So you were not grandfathered in, and so you are out of network. The answer is yes. So you are currently out of network now, and so this is actually going to be no change for you at all, right? It's really a change for the people that were grandfathered in. So there is no change for you at this moment in time at all. It's exactly the same heading into next year. So that's a great question. Okay. All right, well, believe it or not, I mean, I think that is from all of the questions that I'm seeing here. Let me try to double check, make sure it's not scrolling anywhere. I can't see anymore. Okay, so what I'm going to do is I'm going to go ahead and I'm going to take a look at the all of you and see if you can either raise your hand if you have your screen up, if you have a question or you would like to click your button next to the mute, that'll say ask to unmute. All right, so I see one. Let's go ahead. All right, hey, how's it going?
Can you hear me?
I can hear you.
Good afternoon, Paul. Thank you for hosting this. My question is simple. Will you be hosting, once October comes around, or will you be hosting some Zoom sessions for us also?
Sure, absolutely. So
Cool.
as we head into that time period, many of you will know that I am doing, in-person seminars, workshops, and I'm going to be doing individual videos that are going to break them down. I'll probably do at least one for every carrier, and then I'll record it and I'm going to post it.
Okay.
So I'll have that information out there. I'm probably not going to send the video, but I'm going to send you to a YouTube link and you can watch the video for the comparison. So I'll
Okay.
kind of have a split screen or do like, hey, here's the 2024 benefits, here's the 2025 benefits, and then I'll do a very specific one for alignment PPO as it relates to Scripps.
So we'll continue with email messages so we know we can schedule our time to view any of that. Okay. That was my question.
So this is the crazy time for, not just me, but all insurance agents who are in the Medicare space, right? Because, so if you don't know this, we'll just write it down, October 15th
Mhm.
to December 7th is the time frame when you can make a change.
Right.
So you can't make a change until October 15th up until December 7th. But plans will come out or they will be, able to be downloaded starting on October 1st. So
Okay.
that's why, I try to say, hey, give me a little bit of time, right? So from October 1st to October 15th, I'm looking at all of the plans, trying to see what the changes have been, make the recommendations, see if any of those plans have that 15% increase I told you about. So that triggers that Medicare supplement guarantee, right? So that's that time period. And yes, I will be, in person in my office in Carlsbad, as well as doing meetings. So great questions.
Thank you.
You're welcome. Anyone else, raise your hand or click on the button that says I'm asking to be unmuted. I will put you on here. But was this good for all of you? Was this some good information? Okay. Help you kind of like ease your mind a little bit, hopefully. All right, I'm just going to see, I don't see many people clicking on the link here as far as asking a question. All right, let me just double check the chat one more time because I wanted to try to keep you right under an hour and we're right about that right now. All right, let's see here. And concerned about my doctor may only do a surgical center that is not in network. Okay, so that's a good question. If you have a doctor, typically the doctor has what we would say is rights to certain facilities, right? So you might have a doctor that has rights at multiple. You might have a doctor who has rights at an ambulatory surgical center with Scripps. You might have one that has access to Tri-City, and you might have somebody like I had somebody a couple of years ago who was having an eye procedure, and that doctor had rights to the, oh my gosh, I was gonna say Pomerado, it's not Pomerado. Palomar, thank you. The Palomar Hospital, right? Right at the corner of Escondido and, in that area. And so because of that person's scheduling, that doctor said, listen, it's better for me and I can get you in sooner if we can do the operation at Palomar. And so my client said, well, it doesn't make any difference to me, so let's do it, right? So your doctor may have rights at multiple facilities, and so that's a good question to ask them. But like I said, who is in network for next year? Scripps Hospital and the 4 ambulatory surgical centers. So if you're seeing a Scripps doctor, then you more than likely will be seeing an outpatient surgery at their ambulatory center or the hospital, which are both in network. So hopefully that kind of alleviates some of the questions on that for you. All right, well, we're right about there. So listen, here's the deal. Thank you so much for all of you being here tonight. If there's anybody last minute to open up your, ask me one more live question, we can do it tonight. Otherwise, I just want to say thank you again for all of you who are here. Again, hopefully this recording worked well for us tonight, so I'll be able to go ahead and send it out to everybody. You can re-look at it. We can forward it to people who haven't seen it. And I am always available for phone calls and emails at any time or text messages, and I'll get back to you as soon as I can. But the biggest thing I think I want you to understand is, number one, the plan is still going to be here next year. Number two, it's not being terminated by alignment. It was a change that Scripps requested. Number three, you can have access to Scripps, but at a slightly higher cost. Number four, you're going to want to ask your doctor if they will see you as out of network if you're going to a Scripps facility. And that's about it. And then lastly, I guess, number five, just be patient with me. We're going to get through the rest of this year. No changes are going to be done. I did have a couple people say, well, shoot, I had a surgery. I was thinking about, should I do it this year or next year? Listen, if you can get that scheduled and you want to get it done, it's probably wise to get it done this year, right? You're going to be in network for most people. But again, we can't really make any plan changes until October. But I'm happy to have conversations one-on-one. My next trip, I will be in town July 8th, 9, 10, and 11. All right. So just under a month. All right. Well, I look forward to seeing you in person, answering your questions, and talking to you soon. Thank you again for being here tonight, and have a great night. Thank you.